So, welcome everyone. Our Region 7 Presents topic for today is cultivating a grief-sensitive community through library and community-based partnerships. Thank you for being here. My name is Benny Finch, and I'm one of the Education and Outreach Coordinators in Region 7. I briefly want to introduce the network of the National Library of Medicine, also known as NNLM. The NNLM regional medical libraries are funded by the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. Region 7 includes those states in the top right of the map: Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. Our office is located at the UMass Chan Medical School in Worcester, Mass., and I'm joining you today from Connecticut. We are also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. Before we get into the presentation, I have a few items to cover. Captioning is available by clicking the Show Captions button. We'll be sending out the recording to all registrants within the next couple of weeks. And at the end of today's session, we'll share the evaluation link, which is the first step in claiming continuing education credit. We will also be sharing at that time the slides as well as a handout. So libraries and community organizations are supporting mental health every day through a number of ways, such as collection development, programming, and providing safe spaces for their patrons. We know that mental well-being is important for all of us and all our communities. Today, we will hear from 3 wise women on their work in communities to support mental health and suicide prevention, including the novel program Grief Literacy 101. I will also share some resources from the NLM and NNLM at the end. We acknowledge that some conversations and topics can be difficult to sit with and may bring up your own experiences, so we encourage you to take care of yourselves. If you need to excuse yourself, please do so. We understand. And I would now like to introduce our presenters. Kimberly Mead Walters, MD, is a mother, grandmother, physician, suicide loss survivor, and now executive director of Sharing Kindness. When her beloved teenage son Jeremy died from suicide in 2016, Kim and her family experienced firsthand the gaps in service around grief support and suicide awareness. She and her husband Davis Walters created Sharing Kindness, a 501c3 nonprofit, in 2018 with a mission of building a grief-sensitive, suicide-aware Cape Cod and Islands community. In addition to her role at Sharing Kindness, Kim is also a board-certified family physician, recently retired from a 30-year career as a primary care doctor. Kim is also a member of the Barnstable County Children's Behavioral Health Work Group and is on the board of directors at Cape Cod Children's Place. Kathleen Shine O'Brien, LMHC, is a wife, a mom, a grandmother, and a passionate advocate for suicide prevention and grief support. In her role as Director of Clinical and Community Services for Sharing Kindness, Kathleen has created presentations for the community and schools in cultivating grief literacy. When her sister died in 1984, Kathleen, a social worker, was unable to find grief support services for siblings. Her passion is derived from her belief that no one should grieve alone. Anne Romano, MLIS, is Director of Library Services and the CME Coordinator of Silver Hill Hospital in New Canaan, Connecticut. Anne's library career spans over 30 years in both academic and hospital settings. She completed her master's in Library and Information Studies degree from the University of Alabama and her bachelor's degree from Sacred Heart University. Anne works with clinicians, patients, and families at a psychiatric hospital and collaborates with local public libraries in raising awareness about mental health issues. Anne's commitment to community causes is evidenced in her involvement with the American Foundation for Suicide Prevention. She serves on the board of AFSP's Connecticut chapter, and her dedication to raising awareness and funds for AFSP is a driving force in the fight to end suicide. We will start with two brief presentations from our panelists. First, we'll hear from Sharing Kindness about their funded project and some of their other initiatives. And then we'll hear from Anne Romano about her work as a hospital librarian and as a volunteer with AFSP. And then we'll have time for Q&A. So please add your questions to the Q&A box throughout the presentation, but we will be holding those for the Q&A section. I will now pass it over to Sharing Kindness.
Thank you, Benny.
Thank you, Benny. We are so pleased to be here with you this afternoon to talk about our cultivating a grief-sensitive Cape and Islands through library and community-based partnerships. I'm Kim Mead-Walters, and I'm here today with my colleague.
And I'm Kathleen Shine O'Brien.
Thank you. Next slide. Our goals today, we would like to discuss our Grief 101 program. We want to encourage you all to think about potential partnerships, and we'd like to identify resources, including those from NLM. So a little bit about Sharing Kindness and how we arrived where we are today, sharing with each of you about Grief 101, the presentation that we developed with NNLM funding. A little bit of background for that. In my first professional career as a board-certified family physician, I truly thought that would be my only career. And then in 2016, 25 years into my physician career, the youngest of our 4 children, Jeremy, died from suicide. And whenever I speak publicly about my son and share how he died, I also want to share how he lived. Jeremy was a musician. He was a voracious reader and also really funny. He was a dog whisperer. And he not only called his German Shepherd his furry brother, he had 2 human brothers and a sister, but he named his dog. And if there are any Monsters, Inc. Fans here, he called his German Shepherd Mike Wazowski. So we were the family at the beach or in the park saying, Mike Wazowski, and making people smile. That was Jez. After more than a decade of challenges related to anxiety and depression, Jez was just shy of 17 years old when he died from suicide. After his death, I learned so much. I learned that there were massive gaps here on the Cape and Islands around youth suicide and around bereavement support. The bereavement gap I had actually recognized as a primary care physician. I often heard from patients who had experienced significant loss that they were struggling to find the support they needed. And when I was personally impacted, I learned in a different way. I learned that our society is fairly grief illiterate and that the platitudes that most of us have been exposed to, he's in a better place, or at least you have other children, they actually don't bring support, though I recognize it as the intention of the person offering that. Many of Jeremy's friends were high school seniors and headed away from home, and we just felt so strongly that somebody needed to do something for them. The school didn't, there wasn't a community organization to turn to. And so we planned a suicide awareness walk here on Cape so that these young people could feel that they were doing something for their friend. And the day of that walk in May of 2017, that was actually the day that Sharing Kindness was born. We expected 50 or maybe 75 people to come. More than 400 people came. The vast majority of them we didn't know. They came to honor their person. They came to share their stories. They were seen and heard, sometimes for the first time in decades. And that day, I felt a conviction in my heart that we needed a way to support each other, to build connection and community. And listening at a suicide awareness walk one day each year would not be enough. And then I met Kathleen Shine O'Brien, and I learned that bereavement centers existed. They just didn't exist here. And I learned that evidence-based youth suicide prevention programs existed. They just didn't exist here. And so we became Sharing Kindness with a mission to build a grief-sensitive and suicide-aware Cape and Islands community. We held our 8th Suicide Awareness Walk in May of this year. We offer evidence-based peer-to-peer suicide prevention in 14 middle and high schools across the Cape and Islands. We provide clinician-led peer grief support across the lifespan for all types of death loss, for children as young as 6 through older adults in their 9th and 10th decades of life. We have worked thoughtfully and intentionally to fill those gaps, the gaps around suicide prevention and grief support.
So as Kim said, one of the most important things that we did in listening to the people as we were traversing the Cape, doing some of our suicide, excuse me, prevention work was we need grief support. And so we began really intentionally, again, with thoughtfulness and care to evidence-based programming to do our grief support groups, clinician-led, as Kim had said. And when we brought these groups together and we were asking, what else can we do for you? What else do you need? Overwhelmingly, we heard this is where we're lacking support. Nobody knows how to help us. They're well intentioned, but my coworkers, my neighbor, sometimes even my family, nobody understands what I'm going through. And of course they don't. Nobody understands anybody's grief specifically because it's so individual. But what we recognized was we had an opportunity to build a very solid grief literate and cultivate a grief sensitive community. The big question for any small nonprofit is how are we going to do that? We engaged with our local librarians. We gauged the interest that they had and also that their patrons had, and we obtained and excuse me, LM funding. We had many, many working group meetings with this incredibly brave and brilliant group of librarians. We researched endlessly to make sure that we were coming up with the best possible resources we could. We expanded our online presence in terms of grief resources. We curated a child's grief book backpack that is so beautifully done. These are new publications. It is a variety of types of loss. It is a variety of books from toddlers to middle schoolers. It is something that really can pertain to anybody. And these are available at the libraries on the Cape, where we have presented our Grief 101 presentation. And in that presentation, we talk about many things, but among those things, we knew that people needed to have some takeaway. And we developed care cards and bookmarks for distribution at all of these libraries. When we did our Grief 101, here you have the book pack Kim is proudly holding, and one of our wonderful librarian work group members. The Grief 101 programming is really essentially what is grief? It's normal. Everybody experiences it. It impacts our brains and our bodies. We also talk a lot about myths and biases. Each one of us brings to the world our family stories, and some of those include myths and biases about grief. We're able to say, challenge yourself. Is that valid? Is that accurate? And then the second part of our program is really a little bit more hands-on. What do we do to support the people in our lives who truly are experiencing grief? Not necessarily new grief. It could be many, many years old. Grief is endless. It's timeless. It's not something that we get over. It is something that we work through and we integrate it into our lives. So here's an example of some of our children's books. I will tell you, I have read them all to my 3 grandchildren, some of which they loved and some of which they didn't. There are a couple that are just very endearing. A Garden of Creatures has some of the most beautiful illustrations that I've ever seen. All of these are available in these book packs, and all of these resources are available for you to look at our sharingkindness.org website.
We want to share that the feedback from our community members has been amazing. On the right-hand side of the screen is a thank you note that we received from somebody who attended one of our sessions. And 2 parts that I just want to pull out. Grief 101 is suicide prevention. Knowing how to support someone can save lives. That is the full circle of the work that we do. And I also want to share a little bit further down. This needs to be taught in schools and in the community. We did this to do general presentations with our library, our public library partners. We are now being approached by healthcare and social service agencies to provide similar training to their staff. We're being approached by schools, we and students at schools to offer a similar program for them. We didn't know about the ripple effect when we started Grief 101, but it is really remarkably well accepted and I think will be appearing in different ways throughout our community moving forward.
So taking our Grief 101 from the libraries, it was a natural move and a bridge to fill the gaps in what schools need. And so we were able to create a school-based version. What we do here is all of the schools on the Cape and the Islands are invited to take our peer grief support into their schools. We want to meet the kids where they're at. We know that on the Cape, this 70-mile long peninsula connected to the mainland by two bridges is really hard to navigate for some people. We also know that our childhood bereavement estimation models tell us that we have a very high rate of childhood bereavement. We're about 1 in 9, which is much higher than our state average in Massachusetts. So when schools accept that, the very first step that we do is to provide Grief 101 for their teachers, their staff, and their administrators. And again, using the same format as the presentation that we did in the library, it's a building block for these schools to have better literacy about the grieving process that involves their students. It allows them to be able then to become a resource for the students after we do our 6-week programs, because we know that grief doesn't end. And so they are then able, the students are then able to go to someone in their building and say, I'm having a hard time. I'm having a moment, and have someone be able to actually hold space and sit with them in a way that we know is based on the work that we've done, evidence-based work, tried and true practices, which is going to do so much for these children as they move forward. What we believe is that grief is a natural response to loss, recognizing that loss isn't only death, that we all endure losses. I will tell you what grief is not. It's not an illness or a disease. It's something that we don't medicate against. It's as individual as our fingerprint. We cannot adhere to the expectations and the shoulds of other people. We can't adhere to someone's timeline, particularly if our employer says, you get 3 days off, I expect you back on day 4, or 5 days if it's a family member who's close to you. We understand that this is not sufficient. This is another piece of the work that we want to do. We know that grief is messy, it's not linear, it is certainly not neat, and it is absolutely not tidy. We also, in our presentation, want to bring people to the awareness that there are many types of grief. And what we find is when we can identify these specific grief processes, people have this intense sense of relief, like, oh my gosh, I am not going crazy. So for example, with anticipatory grief, we were doing a group with caregivers with the Alzheimer's Family Support Center. One of the gentlemen was talking about the feelings he had while he was caregiving for his wife with Alzheimer's. He was worried that he also had Alzheimer's. He was confused. He was forgetful. He was unfocused. And when I was able to say to him, you were going through anticipatory grief, then the actual death happened. And now it's a different type of grief. And he said, but wait, I wasn't going crazy? No, your brain was thinking about what was going to happen in the future. It's very hard work. Most of us understand about collective grief. That happens when there's been a mass casualty in your town, in your state, and quite often in the world. We also know about cumulative grief, when we have losses that happen in close succession. And when we can name these types of grief, it normalizes the process for so many people. It gives them context for what they're experiencing and ultimately can make them feel assured and hopefully a little bit better.
We'd like to share with all of you why it's so important to address grief for children and our youth. These children are at higher risk of early mortality, including 2.5 times increased risk of a death from suicide. Bereaved children are less likely to complete high school. They're at higher risk of substance use, particularly in the 5 years following the death of a parent. They're at higher risk of entry into the juvenile justice system, and they're at higher risk of developing mental health problems. We feel so strongly that to develop a more resilient, healthier Cape and Islands community, addressing our grief, as Kathleen had said, 1 in 9 children here on the Cape will experience the death of a parent or sibling by the age of 18. To grow and nurture a healthier community, we must address this childhood bereavement.
What we also know is that grief, as I said before, is as unique as our fingerprint. And what we have to remember is that our relationship with the person who died, or how we imagined that connection was, impacts how we grieve. If we've had prior experiences with loss, it impacts how we grieve. It also doesn't mean that we know how to do it. Each time we have a loss is very different. We also know that age and level of understanding about death varies across the lifespan. But little children, even babies, understand what happens when there has been a loss of a significant person or caregiver in their life. We know because of the way they behave, and we know how we should be responding to those behaviors. Similarly, with toddlers, preschoolers, school-age children, high schoolers, and young adults, each and every developmental stage brings its own unique ideas and understanding about death. Little kids don't understand the permanence. The older kids do. And when we work with our older adults, the massive number of losses that they have can honestly complicate all of their grief. And we give them an opportunity to talk about that. It's also important that we allow people to understand what healthy coping skills look like and allow them to have a toolbox so that they can access them, because we know that it's not one size fits all. We know that some people like to walk in nature. Somebody might want to swim. Somebody might want to ski. Somebody might want to listen to music. Somebody might need to be with people. Somebody might need to be throwing a basketball around. It's all fine. It's all normal. But it's what is tailored to you and helps you in the moment that makes things better. We also want support systems to be available. That might come in the form of a faith-based group. That might come in the form of peer grief support. But in the absence of those support systems, because grief is so isolating and so lonely, it can actually hinder a healing process. And we also need to be culturally aware. Cultural humility is something that we hear about quite often. And every culture has its own way that they mourn. We have to be sensitive to that. We can't dismiss it. And family frameworks and mourning rituals are also varied. And our feeling is, as long as it is not harmful or hurtful, then it's acceptable. And we want to endorse those practices. We want to support those people. And we also want to say, I may not understand. Please tell us more about it. This is probably the slide where, when I'm presenting in a library in particular, I can hear nervous laughter throughout the room. Kim had spoken about the platitudes a little bit earlier in our presentation. We understand that these are things that are well-meaning. We also know that people often don't know what to say. And so we say to people, you can be silent. Your physical presence and able to hold space for a bereaved person is more than any words that you could possibly offer. But when we say things like, I know just what you're going through, well, we really don't, do we? We can't know what someone else is going through. But instead, if I said, can you tell me more about what this has been like for you? It's a gentle invitation to tell me what's happening. You must be incredibly angry. We hear this a lot when it comes to stigmatized deaths, when it comes to overdose or suicide. You must be incredibly angry as a judgment leveled upon a bereaved person, usually a parent, but also siblings and extended family members. I'm judging that you should be. What if I'm not angry? I get to say that and you don't. But instead, if I said, people have strong feelings around this, again, a gentle invitation to tell me, what is the story? There are lots of things that we say. At least they're not in pain. At least they're in a better place. The minute someone says at least, the hair in the back of my neck goes right up. At least and still are probably the two least favorite words of a bereaved person. But I am interested in knowing, what sorts of things have you been thinking about?
We'd like to finish up by sharing a story. Our tagline at Sharing Kindness is Start the Conversation. And we developed Grief 101 with our NNLM funding for public education and to encourage informed grief conversation. There is also a ripple effect here. Recently, a bereaved teen in one of our groups shared that there had been an unexpected student death in their school. They didn't know the student who died, but they did have a shared friend group. And this teen shared with us, I knew just what to do to support my grieving friends because of what I had learned. I know I can't fix their pain, but I can be present and let them know I care about them, and I can ask them to tell me about their friend. The work of Sharing Kindness is creating sustainable change in how our community addresses grief and loss, stigma, and mental health. And doing so with NNLM funding support and the collaboration of our local libraries and librarians has been just an incredible experience for all of us. We're very grateful. Thank you.
Thank you.
Thank you so much, Kim and Kathleen, and Sharing Kindness, for the amazing work that you're doing and for your willingness to share that with us today. And we'll have chances to ask you some questions later and to talk more. But for now, I would like to hand it over to Anne Romano for her presentation.
Thank you, Benny. Good afternoon. I'm Anne Romano, Director of Library Services and Coordinator of Continuing Medical Education for Silver Hill Hospital and a board member of the Connecticut chapter of the American Foundation for Suicide Prevention. I have nothing to disclose. Silver Hill Hospital is a private, not-for-profit psychiatric hospital with inpatient, residential, and outpatient programs serving adolescents and adults. I manage a medical and patient library. Silver Hill's mission is to reduce suffering from mental illness and addiction. One of our hospital values is community building. Collaboration is essential to achieving our mission. We build community in many ways among our patients, families, and staff, within our state and region, and with other healthcare providers, researchers, and advocacy groups. We know we are stronger together. I was introduced to the American Foundation for Suicide Prevention because my hospital sponsors a walk in Fairfield County every fall to support their mission of saving lives and bringing hope to those affected by suicide. Today's topic is grief. We know that loss is a part of life, and grief is the natural part of the healing process. We know that grief involves some type of loss. That loss can be death, family, friend, coworker, pet, loss of a job, marital status, housing, financial stability, health, and other major events. Everyone experiences grief at their own pace. As a hospital librarian, I receive calls from doctors, nurses, social workers, and the chaplain asking me to send patients and family members information about grief. The materials I distribute may be in the form of handouts, educational books, memoirs, podcasts, and support groups. I keep updated bibliographies on various topics, one of which is grief and loss. Popular book titles include How to Live When a Loved One Dies by Thich Nhat Hanh, Finding Meaning, The Sixth Stage of Grief by David Kessler, and Ambiguous Loss, Learning to Live with Unresolved Grief by Pauline Boss. First, I want to briefly share with you some of my favorite websites that I disseminate to patients and their families. You are probably familiar with the National Library of Medicine's consumer health resource. Medline Plus is available anytime, anywhere for free. One of the nice things about Medline Plus is that it also curates lots of information from other sources and organizations on the site. You don't have to do a Google search and wonder if the search results are quality online resources. Please be aware that grief was the MESH, the medical subject heading term, and then in 1988 they introduced bereavement. In a quick search in PubMed, I searched grief and there were 16,000 entries and 21,000 with bereavement. I continue to use both terms. The National Institutes of Health has lots of resources pertaining to grief, bereavement, and loss. SAMHSA, the Substance Abuse and Mental Health Services Administration Agency, and its website includes information for the public and for professionals. I have circled at the top right of the screen the In Crisis Call or Text 988 link. If you click on the link, you'll find information about 988 and other helplines. You'll also find information on National Grief Awareness Week, recognized the first week of December. Another organization that provides mental health resources is NAMI. They are a nonprofit grassroots organization dedicated to improving the lives of all people affected by mental illness. A new program they developed is called Out of the Abyss, which is a peer-run support group for individuals living with suicidal thoughts and urges and previous attempts. This group is intended to provide non-judgmental space to openly share about pain and experiences, create opportunities to build community, and find hope in healing. Another national organization that has a presence throughout the whole country is AFSP. AFSP offers free educational programs and are always looking for venues like libraries to host these events. Examples include More Than Sad for teens, It's Real for college students, Talk Saves Lives for those 18 years and older, a program that I've given at my local public library. Programs can be tailored to the LGBTQ community, workplace settings, firearm safety, faith-based communities, Hispanic communities, and much more. A new program being rolled out this Veterans Day is a program specifically for veterans. A training that is great for the public as well as those who work with others is called QPR, Question, Persuade, Refer. The gatekeeper training is usually 1.5 hours. Libraries would be great venues for this public training. I just attended the facilitator training class. What is a gatekeeper? According to the Surgeon General's National Strategy for Suicide Prevention, a gatekeeper is someone able to recognize a crisis and the warning signs that someone may be contemplating suicide. Gatekeepers can be anyone and include parents, friends, neighbors, teachers, ministers, doctors, nurses, office supervisors, squad leaders, foremen, police officers, advisors, caseworkers, firefighters, and many others who are strategically positioned to recognize and refer someone at risk of suicide. As a QPR trained gatekeeper, you will learn to recognize the warning signs of suicide, know how to offer hope, and know how to get help and save a life. Mental Health First Aid is an evidence-based early intervention course that teaches participants about mental health and substance use challenges. In a partnership with the National Council for Behavioral Health, the American Foundation for Suicide Prevention chapters host mental health first aid trainings across the country. It's an 8-hour training that teaches participants a 5-step action plan to help someone who is suffering from a mental health crisis. If you're looking for programming, this would be perfect for staff and patrons. It can be done on one day or 2 half days. You can also visit the Mental Health First Aid website to locate trainings in your area. Instructors need to teach 3 classes a year to remain certified, and I always look for trainings offered for free. It teaches you how to identify, understand, and respond to signs of mental health and substance use. I've attended both the adult and youth trainings. Classes are held virtually or in person. I attended the adult class in person at Connecticut Clearinghouse, another terrific resource that I'll speak about next. Connecticut Clearinghouse, located in Plainville, Connecticut, is a program of the Wheeler Clinic and is funded by the Connecticut Department of Mental Health and Addiction Services. They just revised their website and I find it very user-friendly. Their librarian, Agnes, is extremely helpful. For those living in Connecticut, you can borrow books and request brochures and posters. Anyone outside of Connecticut can access resources on their website and gain ideas as to materials to purchase for your library. I recommend joining their listserv to stay abreast of what is going on. In addition to books, they have resources in other languages, posters, brochures, links to podcasts, and offer free coloring and activity books. As I mentioned, Connecticut Clearinghouse hosts trainings that include mental health first aid and QPR. Change the Script is a statewide campaign that now includes 2 purple vans. They meet people where they live and work and provide educational materials that include medication safety, harm reduction, and so much more. I schedule them to attend our suicide prevention walks. When I recommend books to patrons, I generally ask them what they're looking for: educational, memoir, and some ask for graphic novels. I'm not sure how many of you are familiar with the term graphic medicine, but I'm certain that you're all familiar with graphic novels and memoirs. Dr. Ian Williams, an MD and cartoonist, coined the phrase graphic medicine and describes it in this way: graphic medicine is the intersection of the medium of comics and the discourse of healthcare. Many graphic medicine books address the topic of health, including grief, creating a unique opportunity for readers to learn about healthcare experiences. The graphic medicine website, graphicmedicine.org, has a blog and a podcast and lots of great books to feature and perhaps to purchase for your collections. Here is an example of a 2025 book about grief, a #1 New York Times best-selling graphic memoir about a father dealing with the sudden loss of his young daughter. Tom Hart's 2-year-old daughter, Rosalie, was a bundle of energy, always running, exploring, and fascinated by the world around her. But one night, when Tom went in to check on her in her crib, he found her silent, still, and unbreathing. Without a sign that anything had been wrong, she had passed away in her sleep. Now I want to turn the focus on ideas for library programs. You might consider setting up book displays to celebrate various months. May, Mental Health Awareness Month, September, Suicide Awareness Month, and as I mentioned earlier, that the first week of December is National Grief Awareness Week. By now, you should be familiar with 988. People can call or text 988 or chat 988lifeline.org for themselves or if they're worried about someone who may need crisis support. 988 serves as a universal entry point so that no matter where you live in the United States, you can reach a caring, trained counselor who can help. 988 offers 24/7 access to trained crisis counselors who can help people experiencing mental health related distress. That could be thoughts of suicide, mental health or substance use crises, and emotional distress. Libraries can print or order 988 materials like stickers, magnets, posters, wallet cards, and much more from SAMHSA. Consider pulling wallet cards by computer terminals. 988 Day is a national initiative dedicated to raising awareness about the 988 Suicide and Crisis Lifeline and emphasizing the importance of mental health and suicide prevention. The first 988 Day was held on September 8th, 2024, and focused on the theme No Judgment, Just Help. 988 Day highlights how communities, organizations, and people supporting mental health are creating positive buzz around 988 in their own fun and creative ways as a method of raising awareness. The 2025 theme is Compassionate Help, Anytime, Anywhere. Last year, I organized painting rocks for our hospital labyrinth and chalk drawing across our campus. We used paint pens, which is less messy than actual paint, and I ordered stencils for the chalk designs. In the previous slide, there was a yard sign that one neighboring town displayed at public libraries and other municipal buildings, as well as private residences. I know I've given you a lot of ideas, but here are some more. These are some possible resources or programs that you may want to consider at your library. Events like these can help give people permission to talk about mental health in an open environment, breaking down that stigma, and give the library a chance to provide additional mental health information. Host a training, invite a speaker or a therapy dog. I want to conclude by sharing examples of what I've done in the past. Host book clubs. Last year, I applied for a collection development grant from the NNLM and was awarded the monies to spend on the topics of loneliness and isolation. I offered books for book club options to our patients and staff, and next I'll be reaching out to local public libraries to offer titles for in-person or virtual book clubs. Self-care boxes. I contacted a local public library and offered to run a program on coping skills for stress. I purchased small white boxes and brought along magazines for collaging. The library supplied the scissors and glue sticks. My hospital donated silly putty, fidget spinners, a flash drive of meditations, and stress balls for the boxes. I have a box at work and keep another one in my living room. Mine contain favorite items like coloring books, bubbles, and Play-Doh. Mental Health to Go kits. I selected 12 topics and put together boxes that are made to look like books. These were donated to two local public libraries, and from an article from a newspaper about these kits, a local police department contacted the hospital and requested some of the kits. This is what the cover of the Mental Health to Go box kit looks like for suicide awareness. A spine label was also created with a call number. I'd like to end by sharing about a fun initiative that I've enjoyed for many years now, and that is by participating in Gizmo read-alongs. This book is appropriate for children growing through the grieving process. Gizmo is on the right, his brother Gadget is on the left, and in the middle is the Gizmo plushie stuffed animal. Gizmo is the narrator of the book, is a therapy dog, and is now retired, but still working. The book talks about your thoughts, feelings, and actions when you are sad, mad, and worried, and it discusses what is mental health. Mental health is equally as important as physical health. Daily activities that support mental health wellness, how to identify when mental health needs attention, internal, external healthy coping strategies that support mental health, how to identify and connect with trusted adults, and resources to share with trusted adults. Last month, I was asked to attend a wellness camp, a wellness day at a local camp, and read to over 100 children in a 3-hour block of time. Each child received a copy of Gizmo's Possum Guide to Mental Health book. Wherever you work, maybe it's in academia or in a hospital, I believe we can all take a part in breaking the stigma of mental health, thus creating awareness within our own organizations and with outside communities. Thank you very much. If you have questions down the road, please feel free to contact me.
Thank you all so very much. Now we are going to have some time for questions. So please, if you could enter those in the Q&A box. I am going to stop sharing my screen in a second, but I would like to start off the questions. So Anne, I'm going to start with Anne. So you mentioned those mental health to-go boxes. Could you share a little bit more about those and some examples of the experience with those and what's included in those boxes?
Sure. First, the hospital had done a community needs assessment, and as a result, we found it was our obligation to educate the community about mental health issues. So there was a library in Missouri that had done these mental health to-go kits, and it was kind of like the concept of the backpack, that you can walk into a library and have a complete kit ready to just check out at the circulation desk. So the box itself contained 2 books. And as an example, for suicide, it was the book Cracked, Not Broken, Surviving and Thriving After a Suicide Attempt, and the book Why Suicide? Question and Answers about Suicide, Prevention, and Coping. It also included a DVD, Stories of Hope and Recovery, a video guide for suicide attempt survivors. It also contained a bibliography of books and websites. The Regional Behavioral Health Action Organization called the Hub provided a list of resources and support groups. And then the hospital provided stress balls and a flash drive of guided meditations. So there were these 12 kits, and they were provided to the New Canaan Public Library and the Wilton Public Library. And then I also created some kits for the New Canaan Police Department, knowing that those were not going to be checked out, but they were just going to be given probably to those domestic calls that they would respond to. I just want to mention that part of the challenge working in a library and having a kit like this, we clearly had to identify the fact that it could not be returned in a return drop, that they needed it returned inside the library. Inside, there was a list of things that people could remove from the box, and then things that had to be returned in the box. And then we had a box to replenish, like the stress balls and the guided meditation, as well as any handouts that were part of the kit.
Thank you so much. I can imagine people being really excited about having those kits available. And I know you mentioned also that you had them like cataloged so they could be placed with the collection
Correct.
specifically.
I worked with the libraries to create the call number for them, so it was seamless, the spine that we came up with. The other thing that I just want to mention in terms of a challenge is that the first library, the boxes are 12 by 9. So the first library, we did it in the lengthwise, the 12 inches, and it was fine for their shelf. When I went to the Wilton Library, I realized that I needed to do it the short side because there's shelves were not as expansive. So you do have to do some work before you create these boxes and realize that you want them seen on the shelves with the call numbers.
Thank you. And Kathleen and Kim, I know that you shared that those book packs that you put together for each library where you presented. And I know that you said the books are available on the website, but I'm curious if you have any stories about how you found those titles or anything that you would want to share.
So one of our librarians that was part of our work group is a children's librarian, and she worked tirelessly to look for newly published books that were not already on the shelves of libraries on the Cape and the islands. And of course, with a newly published book, it's a little bit easier to know that there won't be multitudes of those copies on the shelves. So that was kind of the first task. We didn't want things that were already, we wanted to make good use of our money. We wanted to make sure that we weren't duplicating services. So that was her first task. And then when she would buy the book and she would, or the library would, and she would bring it to our work group meetings. And we would all kind of weigh in on what we felt about that particular book. Was it appropriate language that was being used? Was it safe messaging? Was it appropriate for the developmental age that it seemed to be intended for? Were the illustrations exciting? Would it be something that would be captivating for a young child or an elementary school student? Would it be a book that was easily read to someone? And so we all were able to weigh in, again, through my clinical lens, and then the more academic librarian lenses of the other librarians in the group, and certainly Kim's as a family medical doctor and the stories of the families that she's heard over the years when she has treated them. And so we came up with a list of 12 books, all of which were newly published. And then they're all contained in the backpack that you had seen in one of the slides, a clear backpack. There's a little paper that goes in so that the families or caregivers know what books they're actually getting, and a little bit of a description. And then they and the children can choose which books they want to read, or certainly all of them if that's appropriate and they have time to do that.
Those are all really wonderful projects. And I'm just hearing like all the different types of expertise that came together to do this work. And I'm just really,
And I have to tell you, of all the projects that we do, it was so much fun. And I know that people don't typically think of grief and suicide and loss as fun, but knowing where these books were going and to be able to collaborate in the way that we did, I will tell you that we all looked very much forward to these in-person work groups. It was just phenomenal. So thank you for affording us the opportunity to do that.
and along that, I was just, you both, uh, all three of you have worked with public libraries. So I don't know if there's anything, any lessons learned or any like things you would want public libraries specifically to know about working with a community partner. Just throwing that out there.
I would like to add that when we are doing our grief groups or presentations, there are often community areas where our bereaved folks do not feel comfortable going. And one of the beautiful things about public libraries is that so many people view it as a safe space. I also want to add that I was just so amazed at how well these librarians knew their patrons, knew, how to handle on their needs and how we could work together as community partners. It was remarkable partnership, true collaboration.
And I think the other part that Kim and I appreciated along that same line is that librarians said, we have a large elderly population, and I know that they would benefit from this group. Could you do it at noontime or 2 o'clock? And other librarians would say, we have a lot of working families, and could you offer it at 6 o'clock? And we were able to accommodate the needs of the community. But the only reason we could do that was because of the librarians knowing who their patrons were and being able to meet them where they were.
And I agree with everything that's been said. I think that especially for hosting trainings, like if they could bring in QPR or mental health first aid, definitely the Gizmo read-alongs, different populations, the hours of the library are usually very accessible. And I think as opposed to coming to a psychiatric hospital to a lecture, or inviting like an author or having a book club, I think public libraries are such great resources in the community.
Mhm.
So Margot, I know you've been looking over the Q&A box, so I don't want to take all the time if there are questions.
Yeah, there actually a question that came in from Anne for Anne, and just asking for a list of titles that Anne had talked about. And I believe this came in the beginning of your presentation when you were talking about like Thich Nhat Hanh and those things. And I know we have a hand up, but I'm not sure if that's covered.
I'll just briefly just read those three titles, really popular titles. How to Live When a Loved One Dies by Thich Nhat Hanh, a Vietnamese Buddhist. Finding Meaning, The Sixth Stage of Grief by David Kessler. And Ambiguous Loss, Learning to Live with Unresolved Grief by Pauline Boss. And I can ask Benny to include those in a handout.
Yes, yeah. So if you download the handout right now, they won't be there, but if you give me a couple days, I can make sure that those are added and I'll when we send out the recording, I'll send out those links again. So you'll have those all at the same time.
And that's it for the Q&A.
Okay, then I can ask more questions. So uh is there one resource that you just wish everybody knew about or like I have lots of, I wish every community had these resources and I know they're not everywhere, but is there a resource that you think everyone should know about?
That's a great question. And I'm going to defer to you because you
There's so
you
many, but
touched on so many.
when I table at organizations, whether it's, a high school for a wellness fair or a college for a fresh check day, I'm still amazed that people don't know about 988. And last year I joined, I think, thousands of people throughout the country about wanting to celebrate 988 Day. Um, but we have to educate at a young age. Everyone knows what 911 is, and then now we need to educate everyone. There's 988, simple three-digit code. As for, my number one go-to resource is Medline Plus. And I explain that it's great for mental health and substance use topics, but it's all of medicine. So you don't have to leave that site if you want to look up something like, migraine headache or whatever. So that's a phenomenal resource that I use. And then coming up, like I have a bibliography of books on different topics. So when a social worker calls me or the chaplain calls and says the family wants some resource and stuff, I have already, come up with my top list of books, websites, and sometimes now I'll include like podcasts.
Benny, I would like to add the Dougie Center. As a family physician, as now the executive director at Sharing Kindness, um, this is the nation's oldest. It's our gold standard for support for bereaved children and their families, and their website is just so beautifully done. A family, a parent or a caregiver can put in the age of the child, the relationship, if it's as a grandparent loss or whatever the relationship is, um, and it creates basically a custom list. So if I had to pick one way to support bereaved children and families, I think the Dougie Center website is great. And I will add that it's contained with a lot of other great websites and podcasts and the children's books on our sharingkindness.org website.
I was going to say the same thing. So the Sharing Kindness website is included on the handout, and there are a lot of resources there. So take the time to look. But I will also add the Doogie Center directly to that handout as well when I add those titles so that people will have that. Um, okay, we are very much about to run out of time, so I want to share my screen again if I can. Um, because I want to say thank you so much to our presenters. We're so appreciative of the important work that you're doing and for your willingness to share about that work with us today. Um, I, again, have created that handout with links to some of the resources that are highlighted. Margot, I believe, has already dropped that link. I want to mention a couple more resources. Anne mentioned the graphic novel Rosalie Lightning in her presentation, and Region 7 does have materials for hosting a book discussion on Rosalie Lightning. And I've included that link on the handout as well. On our Region 7 medicine page, graphic medicine page, there are a selection of graphic novels, including discussion guides, but Rosalie Lightning is included. And also, if you are located within Region 7, you can check out our graphic medicine book club kits for Rosalie Lightning. Those include 6 copies of the book and a discussion guide, and those are completely free. So again, there's a link if you'd like to learn more. Also, I've included a link to our next Providing Mental Health Resources in Your Library class, which is going to be offered October 9th. So I just want to make you aware of all of these great resources. And if you are interested in claiming MLACE, Margot will drop that evaluation link in the chat. Completing the evaluation is the first step in claiming your CE. And even if you're not interested in CE, we appreciate having that feedback. So please do fill it out. And as we mentioned earlier, thinking about grief and loss can be difficult, and we encourage you to seek the support that you need. And we're so grateful for the supports that we learned about today. Also, if you need to go, we completely understand, but I do want to just take a second to share the Region 7's weekly newsletter. You can scan this QR code, or Margot also has a link for that. This is a great way to learn about our upcoming training opportunities and other things that are happening at NNLM. And again, these are some of the events that I wanted to highlight. I'm not going to keep going, but you'll have this in the handout and these are linked, but we do have some exciting things coming up. And oh, last thing, Anne did mention the mental health first aid, and there is a mental health first aid training being offered by NNLM in September. The spots are limited, but you can learn more there. And again, thank you everyone for joining us today. Thank you so much to our presenters, and take care, everyone.